So, hi guys, welcome. Today we're going to be talking about adult basic life support, and here we're going to see what are the actions one is supposed to take in case you encounter a victim who's had just a cardiac arrest. So, first of all, the commonest or cause of cardiac arrest in adults are usually heart related, especially ventricular arrhythmias. So, adults will benefit greatly from early defibrillation. So, get help as soon as you notice anyone is having a cardiac arrest. So for adult casualties of drowning, so give CPR for 2 minutes before getting help. So we go to the chain of survival. So there's surveillance and prevention, there's recognition and activation of emergency, there's immediate high quality CPR and rapid defibrillation. So after that, you get advanced life support and post arrest care. So another pattern is recognition and activation of the emergency. Get immediate high quality CPR to the patient. There's rapid defibrillation. There's basic and advanced emergency medication services so as to reinstate the heart rate of the patient. And then we go to advanced life support and post arrest care. So below is an adult basic life support logarithm. So here it shows first of all you assess the patient. Is the patient is unresponsive with no breaths and no normal breathing pattern, you can activate an emergency response, calls for help. At this point, you start a CPR, you push hard and push fast. After this, you check the rhythm. As well, you can go get a defibrillator, check the rhythm, shock if indicated, and repeat after every 2 minutes. So here we get CPR is easy because it all entails about compressions, airway, and breathing. So you want to get the patient to receive enough oxygen so our circulation to continue as normal, so that you don't get organ damage. So compressions here, you push hard and fast on the chest, on the center of the chest of the victim. You secure the airway so the victim's head to lean back and lift the chin up to open up the airway. So here, then you give breaths. Um, if it's an emergency setup, you have to give mouth to mouth breath, but you can ensure that you don't pick up an infection by creating a barrier by putting up a cloth so as to filter the air that is going into the patient so as you cannot pick up infection easily. So first of all, you check for the level of unconsciousness. You ask the patient, call them out. You can be able to check the patient. If there's no response, you check for breathing. 5 to 10 seconds. If no breathing or no normal breath, so call for an ambulance or activate and call up for help. So you can also check for carotid pulse for 2 to 10 seconds. If there's no pulse, you give 30 chest compressions. You press hard and deep and fast into the sternum. As you After every 30 chest compressions, you give 2 breaths. Once every 5 seconds, taking 1 second for every breath. So minimum interruptions should occur. So keep alternating 30 compressions for 2 breaths. An automated external defibrillator, if it's available, you can activate it as you call for help. So adult rescue breathing. So the casualty is not breathing but has a pulse. You give a rescue breath, 1 breath every 5 seconds or 10 to 12 breaths per minute. Note, so casualties with agonal breathing should be handled as if they are not breathing. So agonal gasps are inadequate breath associated with cardiac arrest. So the sequence of unchanged or the ratio still remains 30 chest compressions with 2 breaths. So first of all, the first person checks goes to the head while the second keeps to the chest. So as the chest compressions are being given, the second rescuer can be giving the 2 compressions. So you check the level of consciousness. If there's no response, you check for breathing. If no breathing, so the second rescuer activates emergency and calls for help as the first rescuer checks for circulation and carotid pulse 5 to 10 seconds. So for the second rescuer, if the casualty has a pulse, you give 2 breaths once every 5 seconds, and as you reassess the circulation every 2 minutes. So note, if the casualty has no pulse, so you give 30 chest compressions as the first rescuer gives 2 breaths alternately. So you continue the CPR alternating 30 compressions to 2 rescue breaths until you achieve a pulse. If you don't achieve a pulse, you can always get a defibrillator to jam up the patient so that you can try to reinstate the level of normal heart rhythm. So you have to switch after every 5 cycles to avoid exhaustion, because the moment you're giving CPR every 30 compressions, that can be really exhausting. And for the first and second rescuer, they always have to alternate so that they always have to keep up with the rhythm so as to maintain the patient is receiving adequate oxygen levels without and reasonable chest compressions. So for advanced airway, so for casualties with endotracheal intubation, so Coble's tube is in situ. So do not stop compressions to give rescue breaths. So perform chest compressions continuously. So give 8 to 10 breaths per minute every 6 to 8 seconds. So switch positions after every 2 minutes or 5 cycles of compressions, as we had talked earlier on. And after that, you put your patient in recovery position for unconscious casualties who is breathing. So with this, we can be able to help our patients who have encountered heart attack or they've drowned. Always remember to keep our patients on recovery position. Thank you. Have a nice evening.